Hi, friends. A significant percentage of the population struggles with kidney diseases, from primary issues like kidney stones to long term problems such as high blood pressure, diabetes, and blockages in blood vessels. These conditions can eventually lead to the destruction of the kidneys. Prostate diseases, common in older men, can also affect kidney function. Additionally, pregnant women and diabetics have a higher likelihood of urinary tract infections. The side effects of drugs that many people consume under the guise of medication also play a role. It's painful and frustrating to realize that most kidney diseases could be avoided if not for prolonged and careless use of medication. Kidney stones form when minerals and acidic salts accumulate in the kidneys. This usually happens when these substances are present in higher concentrations than can be dissolved in your urine. The main symptoms of kidney stones include severe pain in the sides and back, below the ribs, pain while urinating, pink, red, or brown urine, and frequent urination. Proper treatment is necessary for this condition. Inflammation of the kidneys is scientifically known as nephritis. This can occur due to infections or as side effects of certain medications. Like kidney stones, infections in the kidneys also require accurate treatment. What happens when the kidneys fail altogether? This condition is known as kidney failure. It can be either a temporary condition caused by sudden injury or a serious long term condition requiring constant treatment. It can result from severe infections, poisoning, side effects of drugs, surgery, or injury to the kidneys. If the underlying issue is resolved, the kidneys usually return to normal function. The main causes of chronic kidney disease include untreated high blood pressure, excessive diabetes, or congenital defects. In severe or end stage situations, regular dialysis becomes necessary. Dialysis involves using a machine to remove waste from the blood. In some cases, a kidney transplant may be required. It is crucial for kidney patients to pay extra attention to their diet. The diet should be tailored according to the kidney function and the individual's physical condition. Let's look at some general guidelines. Drinking enough pure water is one of the ways to prevent kidney diseases. It's essential for cleansing the urinary system and preventing dehydration. If you have kidney stones, drinking enough water helps to prevent the accumulation of minerals that cause stones and flushes them out through urine while maintaining adequate hydration in the body. If you've had nephritis, inflammation of the kidneys, or urinary tract infections, drinking a glass of cranberry juice or a herbal decoction like charetta at least half a month can be beneficial. The citric acid in lime juice, for example, has been shown to help reduce urinary calcium excretion and prevent infections. It is generally advised that those with kidney stones avoid leafy vegetables, but this hasn't been scientifically proven. However, it is confirmed that more acidic urine creates favorable conditions for stone formation. Leafy greens generally have the ability to reduce acidity. So, including enough leafy greens in your diet should not be a problem. When protein metabolism is not functioning properly, meaning proteins are not being digested correctly, the urine becomes more acidic. Animal based proteins are more difficult to digest. Therefore, it is better for those prone to kidney stones to avoid milk, dairy products, eggs, meat, and large fish. Plant based proteins from lentils and legumes can be made easier to digest by sprouting them or adding ginger during cooking. There used to be a notion that kidney patients should avoid foods rich in calcium and potassium. However, today we understand that consuming enough calcium rich food can prevent stone formation. Similarly, potassium rich foods support heart function, which in turn helps control blood pressure. This is good for kidney health. Next, Attention should be paid to the non-steroidal anti-inflammatory drugs, NSAIDs, that you often take carelessly as medication. These NSAIDs are usually used to reduce pain, swelling, and fever. Common pain relievers like ibuprofen, aspirin, naproxen, and acetaminophen fall under the NSAID category. Side effects of these drugs are usually not apparent with short-term use. However, pregnant women after 6 months and those with kidney problems should avoid using pain relievers. Taking certain painkillers together, such as aspirin and acetaminophen, can disrupt kidney function. Selective pain relievers cause fewer problems, but 95% of pain relievers available on the market today fall into the non-selective category. Long-term use of NSAIDs can lead to significant consequences, so it's wise to be cautious. In summary, following a traditional diet that includes leafy greens, vegetables, legumes, pulses, whole grains, and seasonal fruits as much as possible is ideal. Reduce or avoid non-vegetarian food, outside food, drink enough water. Avoid drugs disguised as medications like pain relievers. Use only side effect free drugs when necessary. And carefully read and understand the labels on all packaged food products before consuming them. By doing these things, we can effortlessly maintain kidney health. Wishing everyone good health and well being until we meet again.